Hello everybody, welcome to another Sars Cov 2 update on my YouTube page. Today I would like to give you a few updates on a few articles that I've read recently on various subjects about the Sars Cov 2 disease, virus, and the COVID-19 disease. Let's start off with an article I found in the Popular Science magazine, which was written by Kate Bagley on December 28, 2020. Headline, Can you spread COVID-19 after vaccination? Here's what we know. So I'm not going to read you the whole article. Excuse me. I'm just going to read you some relevant information in these said articles. So, in this article, it says, it would not be so far-fetched to have a vaccine that protects you from developing the worst COVID disease, but you could be infected and you could be spreading it without getting really sick, says Jeffrey Bethany, a professor of microbiology, immunology, and tropical medicine at the George Washington University School of Medicine and Health Sciences, who works on vaccines for parasitic diseases and HIV. There is hope that they prevent transmission, but we simply don't know enough about them yet. So, quick question. If, while taking the vaccine, you are still contagious and can still spread the virus, then why make us prove vaccination to travel or to go to a concert? Or it seems illogical. I know it's not set in stone that we're going to need a vaccination passport to travel or to assist to concerts or big sporting events. But governments have been throwing this balloon out, and people have been pushing for it. A lot of important people have been pushing for it. And some countries, like France this past week, have announced that they will probably require proof of vaccination to travel. So once again, I ask, if you guys want to see this article and read it in depth, I'll repeat the title. It's in the Popular Science magazine, so popsci.com. Headlined, Can you spread COVID-19 after vaccination? Here's what we know. So this doctor, Jeffrey Bethany, says that it's very possible that after vaccination, you can still spread it. It will just prevent you from getting really sick. And that sanitary measures need to be kept in place, which I have no problem with. It's been 9 months, 9 months of COVID, but about 5-6 months of wearing a mask. Those things, 2-meter distancing, washing of hands, I don't really have a problem with. What I do have a problem with is lockdowns when they're proven that they don't work. And I'm still out there on the vaccination. I'm trying to get informed, trying to read studies, and I'm still on the fence. I'm not sure. One thing I am sure of is that government needs to not prove to me, but convince me that vaccination is important and that it's safe. Once that being said, if, like this doctor says, that the vaccination protects you from severe disease from the virus, but does not protect you from being contagious and spreading the virus, I don't see why proof of vaccination will be needed in all these places. Smells a little fishy to me. I'm just asking the question, not assuming anything. Let's move on to the next article. So, this one is published in the local10.com, the local news site. And it's titled, Study Investigates Effects of COVID-19 Vaccine on Male Fertility. This one's a short one, so I'll read all of it. The University of Miami is investigating the possible effects of the coronavirus vaccine on male fertility. Lead researchers, Dr. Ranjit Ramasamy, a reproductive urologist with UHealth initiated an earlier study which found the virus was present in the testicles for up to 6 months following infection. That spurred his team to question the virus's effect on sperm and reproduction. His team is now looking at the potential impact of the vaccine as well. We're evaluating the sperm parameters and quality before the vaccine and after the vaccine. From the biology of the COVID vaccine, we believe it shouldn't affect fertility, but we want to do the study to make sure that men who want to have kids in the future, to assure them that it's safe to go ahead and get the vaccine. So basically, a little side note over here, they are not sure. So for now, he says there's no reason to believe that it affects fertility in males, but they also have a doubt, so they want to study it to make sure that males who want to have kids in the future, assure them it's safe to go ahead and get the vaccine. Study participants must have a fertility evaluation before receiving the vaccine. To protect fertility, some men may want to consider freezing their sperm prior to vaccination. Well, that's a big one. So, the article ends by saying, to protect your fertility, some men may want to consider freezing their sperm prior to vaccination. Okay. So that doesn't reassure me much about the vaccine. But let's go on with this COVID update. Let's talk a bit about the testing. On the World Health Organization's website, WHO.int, they have a type of advisory. Well, they have this advice. Let's just say they have this advice titled "WHO Information Notice for IVD Users." It's pretty detailed. Nucleic acid testing (NAT) technologies that use real-time polymerase chain reaction, the famous PCR test that most of the countries use, which we do here in Canada and Quebec, for the detection of Sars Cov 2. And it says, the purpose of this notice, to ensure users of certain nucleic acid testing technologies are aware of certain aspects of the instructions for use, IFU, for all products. Description of the problem. The World Health Organization has received user feedback on an elevated risk for false Sars Cov 2 results when testing specimens using PCR reagents on open systems. So I'll just read you the first article of this, the first paragraph of this notice. As with any diagnostic procedure, the positive and negative predictive values for the product in a given testing population are important to note. As the positivity rate for SARS CoV 2 decreases, the positive predictive value also decreases. This means that the probability that a person who has a positive result, SARS CoV 2 detected, is truly infected with SARS CoV 2 decreases as positivity rate decreases. Irrespective of the assay specificity, therefore, healthcare providers are encouraged to take into consideration testing results along with clinical signs and symptoms, confirmed status of any contacts. So, we already knew that these PCR tests caused a whole bunch of false positives. Just the scientific literature on the matter is not, there's no consensus on exactly what is the percentage of false positives. Some say 50, some say 30, but there's definitely false positives. The PCR test does produce false positives. So, at the beginning of this pandemic, when we were more concentrated on hospitalizations and deaths and intensive care capacity, we weren't much looking into the cases. Well, during the second wave, if we can call it that, suddenly our government has decided to concentrate more on cases to measure its lockdown and restrictive measures. So considering that they're using more the cases, the positive cases to inflict these restrictions on their population, the fact that these PCR tests produce a large amount of false positives is a bit worrisome. And I ask, should new cases be the measuring stick for further lockdown measures? Going on. So, let's go on to a bit more of lockdowns. You guys know I like reading about lockdowns and if they work. So I'll end today's little Sars Cov 2 update with 2 articles about lockdowns. First one was published in the MSN.com website, and it was written by Eva Wall on December 10th, 2020. And it's titled, "Who Condemn Lockdowns and Say They Only Make Poor People Poorer?" Who being the World Health Organization. A COVID-19 envoy appointed by Director General of the World Health Organization, Dr. Tedros, has appealed to world leaders to stop resorting to lockdown to control the pandemic. Dr. David Nabarro, who has spent his career working for the WHO and the United Nations, seems to have marked a departure from the global health body's early stance on the COVID-19 pandemic, warning about the economic and social consequences of lockdown as a means of controlling the spread of the disease. On Sunday, Dr. Nabarro appealed to the world leaders to stop using lockdowns as your primary control method, insisting that such drastic measures can have a dire impact on global poverty rates. Speaking to The Spectator, the British doctor stated, "We in the World Health Organization do not advocate lockdowns as the primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted, but by and large, we'd rather not do it." Dr. Nabarro went on to say that developing economies had been indirectly affected by lockdown measures, adding, "Just look at what's happened to the tourism industry in the Caribbean, for example, or in the Pacific because people aren't taking their holidays. Look what's happened to smallholder families, farmers all over the world. Look what's happening to poverty levels. It seems that we may have a doubling of world poverty by next year. We may well have at least a doubling of child malnutrition." So basically, all the gains we've done in the last 30 to 40 years fighting worldwide poverty has been basically thrown out the window in 1 year because of these lockdown measures. Think of that for a second. Think about all the children that won't be able to eat because of these lockdown measures. It's really important to think about it. Dr. Nabarro continued, "Lockdowns just have one consequence that you must never even belittle, and that is making poor people an awful lot poorer." He concluded, "And so, we really do appeal to all world leaders. Stop using lockdown as your primary control method. Develop better systems for doing it. Work together and learn from each other." So this is Dr. Nabarro, Special Envoy to COVID-19 from the World Health Organization, asking world leaders to stop the lockdowns and develop better systems to protect their vulnerable population. Not me saying it. It's Dr. Nabarro, Special Envoy for COVID-19 from the World Health Organization. Don't come at me. And my last article I will be talking to you about was published in The Spectator, written by Dr. Matt Strauss. Dr. Matt Strauss is the former medical director of the critical care unit at Guelph General Hospital, Canada. He is now an assistant professor of medicine at Queen's University. So he wrote this article in The Spectator on October 14, 2020, the day of my birthday. Look at the coinky dink. A medic's case against another lockdown. So do no harm are the 3 words all doctors must follow in the course of their work. These words make me convinced that COVID-19 lockdowns are the wrong approach, and a growing number of doctors are on my side. Medical students throughout the West are taught the principles of beneficence and non-malfeasance as pillars of medical ethics. In simple terms, they dictate that the likely benefits of our treatments ought to substantially outweigh their potential risks. In my practice, I prescribe medications like atorvastatin to lower cholesterol or warfarin to thin the blood, because international randomized double-blind control trials have proven that their benefits far outweigh their risks. If I were to prescribe thalidomide, which causes birth defects, for morning sickness, or fen-phen, which causes heart problems for weight loss, that would be unethical malpractice. Their risks outweigh their benefits. Generally, prescriptions for such medications are not allowed because regulatory bodies like the Food and Drug Administration in the US or the MHRA in the UK take them off the market once their disproportionate risks become clear. If lockdowns were a prescription drug for COVID-19 treatment, the FDA would never have approved it. The seminal Imperial College London paper and other mathematical models like it were used to justify their use. Clinicians would never prescribe a drug or propose a surgery based on such modeling. The now well-published failure of these models to accurately predict COVID-19 outcomes proves the rule. Luckily, we no longer have to talk about mathematical models. We now have 7 months of real-world data to look at. Some pundits compare Sweden to Norway to argue for lockdown. Others compare Sweden to the UK or Florida to New York to argue against it. Either sort is vulnerable to accusation of cherry-picking the data. In medical science, we rely on epidemiologists to take all the available data from all the countries and perform statistical analysis to correct for as many different variables as possible. This has now been done for lockdowns. In August, The Lancet published an analysis of data from 50 countries. The researchers found that full lockdowns were not associated with decreased mortality from COVID-19. These are hard outcome data. Reality cannot be waved away with theories or projections. So much for the perpetrated benefits. What about the risks? We cannot answer this question fully because a worldwide lockdown experiment has never been run before. However, evidence for the harms of lockdown is now piling up in the US. Homicides are up 50% compared to last summer. In France, domestic violence calls are up 30%. In Canada, almost 3 times where we live, almost 3 times more people are contemplating suicide compared to last year. And in British Columbia, overdose deaths have tripled from pre-pandemic levels. When you deprive children of their education, adults of their livelihood, and elderly people of their social connections, desperation and despair quickly set in. While a thoughtful person might have predicted this, the mathematical models did not. All of these numbers fit with what I see in my clinical practice. I have personally admitted dozens of elderly people to hospital with illness resulting from social isolation and neglect. Some were literally starving to death. One patient, in her 80s, lived in a retirement community, but relied on family members to feed her meals. When they were socially banned from their premises, she couldn't feed herself and her health quickly deteriorated. Another patient, a 92-year-old woman, simply gave up on life and started refusing her meals once her family stopped coming to visit. Both these scenes were catastrophically inhumane and will stick with me for a long time. Neither is captured in the government's COVID-19 statistics. So if a physician were to prescribe a lockdown to a savvy patient who asked about the risks, the physician would have to disclose the depression, suicide, homicide, overdose, wife beating, and starvation are potential side effects. Rare is the patient who would agree to take such a pill, which brings me to the other pillar of medical ethics, autonomy. Physicians do not force treatment on competent, non-consenting patients. When we discuss treatments with patients, we strive to ground those discussions in the patient's values and not our own. I am a life support specialist. At this point in my career, hundreds of elderly patients have instructed me not to put them on life support. Many have told me they are comfortable with their mortality and that not much time is left to them. They would rather spend it eating ice cream or listening to music with their family, not hooked up to my machines. It is not for me or the SAGE group to tell such a person what they ought to decide. These are questions of values, not medical science, and values are personal. It would be deeply unethical for me to put such a patient on a ventilator against their wishes. It would likewise be deeply unethical for the SAGE group to commit such a person to social isolation. I know that reasonable, educated people can decline to consent to further lockdowns because I, for myself, do not consent to further lockdowns. As a medic, my verdict is clear. Mandatory government lockdowns amount to a medical recommendation of no proven benefit, of extraordinary potential harm that do not take personal values and individual consent into account. Physicians who call for their use should hearken back to these core plans of their ethical training. End of article. I think that was clear for anybody that cared to listen. So, like you've seen or heard in past updates that I've given, like lockdowns don't work, a recap of studies, and in the article, is California's lockdown strategy a success? I keep on seeing more and more evidence that lockdowns do not work, and that locking down 99% of the population to protect 1% is just illogical, and it doesn't come close to common sense. So thanks for listening. This is another update on SARS Cov 2. Hope you enjoyed. See you soon.